Complicated UTIs in dogs can be defined as recurrent infections or those that are impacting the upper urinary tract, such as pyelonephritis. And many of us may reach for Clavamox or amoxicillin clavulanic acid as a first-line therapy for uncomplicated UTIs. We may even consider the use of TMS, but in complicated UTIs, those are not appropriate therapeutic choices. In patients that have complicated UTIs, I need to obtain a sterile urine sample. People may be inclined to use a sterile catheterization in order to get it, but that really risks contaminating it with the normal microbiota of the urethra. So really, I would recommend getting a cystocentesis sample in order to submit for a urine culture. Once I've obtained a urine sample, the next question that we always get is, what are you going to start for therapy, and are you going to start therapy? And that's really patient dependent. If I have a patient that has really severe clinical signs, I may have to elect to start empiric therapy. And in complicated UTI cases, especially if I'm suspecting pyelonephritis, I may have to reach for a fluoroquinolone in those cases while I'm waiting on my culture results. If I have a patient that has a recurrent urinary tract infection, so it's complicated, but they're clinically stable, I may actually talk with the owners about waiting and doing no antimicrobial therapy until I have my culture results so that I can ensure responsible use of antimicrobials for that patient. However, once I get my culture results, I really need to look at what organism is present and look at the antimicrobial susceptibility testing, make decisions of whether my choice was accurate and going to be successful for treating this infection, or whether I need to change my therapy. In really severe cases, especially those that are hospitalized, I may even have to start dual therapy treatment using things like Unison and a fluoroquinolone. In those cases, I'm going to rely on my culture results to make decisions how to de-escalate my therapy for my specific patient. Complicated UTIs, another question that we get commonly is, how long do we treat these infections? And when I went to vet school, I was taught that we needed to treat complicated UTI cases for up to 4 weeks of antimicrobial therapy. And the truth is, we don't have evidence to support that recommendation. And so based on the ISCAD guidelines, the recommendations are for complicated UTIs to treat no longer than 7 to 14 days with antimicrobials. Regards to then, how do we follow up on these patients? Once I have my culture results and I know that my antimicrobial therapy is appropriate for that patient, and remember, I may have to make adjustments. I may have not prescribed the correct antimicrobial. So once I've made those adjustments based on the culture results and I've treated for a length of 7 to 14 days, as long as my patient has clinical resolution, there's no need for additional cultures following. Patients that continue to have clinical signs after being started on appropriate antimicrobial therapies, you really need to get that patient back into the practice and trying to determine what the underlying cause of that treatment failure is. In some cases, you may even have to submit another urine sample for culture in order to make those decisions. It's important to note that it's not appropriate to just prescribe another course of the same antimicrobial without submitting further diagnostics. As a clinician, it's my responsibility to keep antibiotics safe for animals and for humans.